You're a haematologist, your specialisation is lymphoma, but we chatted a week or so ago, and obviously a lot of what you know is related to other forms of cancer. Tell us what it is that you've found, the sort of stuff that we might be able to pass on to our own patients in terms of advice.
Yes, I mean, I think what brought me to focusing in on sort of prevention and improving survivorship for my patients was that, more and more I'm seeing my patients with lymphoma, who often do very well from the cancer itself, have other comorbidities that are hampering the treatments I can give them, and therefore the doses they can receive and their future sort of, survival, essentially, because there are increased risk from some of the treatments that we're giving them, but also because of their preconditions that they have of cardiovascular disease, second cancers, type 2 diabetes. And we know this in general. But going back to your question, I mean, it's embedded in guidelines for decades now, but the most recent guideline on cancer prevention comes from the World Cancer Research Fund in 2018, which really has 9 recommendations for cancer prevention. And if we were to all, adhere to these recommendations, it's thought that 4 out of 10 cancers could be prevented, which is pretty huge given that cancer incidence, particularly in low and middle income countries, are on the rise. And of course, smoking, unfortunately, still remains the top cause of cancer globally and in the UK, but it's soon being caught up with, carrying excess weight, which is a problem we're facing in all our practices. Not eating enough healthy plant foods, or not enough fibre and fruits and vegetables, physical inactivity, unsafe exposure to the sun, and unsafe alcohol consumption. And I would say that there's zero safe level of alcohol consumption when it comes to preventing cancer. So all in all, if we were to put this into practice in our populations, in our communities, for ourselves, then you would significantly reduce the risk of cancer. And this has been borne out in long-term prospective studies. So that's what I talk about. And because I'm particularly interested in nutrition, and everyone asks me, what can I do? What should I eat? What about supplements? And it's nice to be able to give an evidence-based answer to this. And the prevention guidelines really do recommend a diet that's predominantly centered around fruits, vegetables, whole grains, beans, nuts, and seeds. So all the healthy plant foods that we're familiar with being healthy, that are full of nutrients that protect us against cancer and support us to recover better from chemotherapy, radiotherapy, and prevent those other chronic conditions that are so common in people who've had a diagnosis of cancer.